fever. Fox 17's Paul Cicchini has been investigating this all day. And Paul, you spoke with Michigan's chief medical officer. What did he have to say?
Three important words, Janice: alert, vigilant, and prepared. Because while the spread or an outbreak of Ebola is highly unlikely, Dr. Matthew Davis says the chances are very slim. The state is ready to respond and has in place its syndromic surveillance system.
The Michigan Department of Community Health works in partnership with over 90 hospitals statewide to keep track of the symptoms that people have when they're coming for emergency care.
The syndromic surveillance system tracks cases on an hour-by-hour, day-by-day basis, helping healthcare professionals know what they're up against.
We're able to know at the state level whether there are particular patterns of individuals with specific types of symptoms.
Dr. Matthew Davis is the chief medical executive with the Michigan Department of Community Health and also a primary care physician with the University of Michigan Health System. Because of those roles, he's keeping a close eye on how Texas handles the first case of Ebola in the United States.
I will say that here in our state, we're alert and vigilant and prepared for the possibility of a case presenting at one of our Michigan hospitals.
Dr. Davis says Michigan is ready to respond if necessary.
When it comes to the Michigan Department of Community Health and our partners across the state, ever since it was clear there was an outbreak in West Africa, we've been preparing for the possibility that there would be cases here in the United States.
Part of that preparation is working with hospitals and emergency responders, making sure they would not only recognize the symptoms of Ebola, but take the necessary precautions.
The appropriate way to respond to a patient when you're concerned about Ebola is, as a healthcare worker, to put on what's called personal protective equipment, or PPE. That is more equipment than we would use in a conventional patient-doctor visit here in the United States on a routine basis.
Now, coming up at 6 o'clock, we're going to look at how the state of Michigan has been using that syndromic surveillance system in the fight against enterovirus D68 and how it would be helpful in the event that Ebola makes its way to Michigan. Reporting live in Ann Arbor tonight, Paul Cicchini, Fox 17 News.
Paul, thanks for the information.